Okay. Hello, everybody. Good afternoon. My name's Lori Kelly, and I'm the Chief Philanthropy Officer at Providence Health System. We want to thank you for joining us today for an update on Providence coronavirus response. As a reminder, the information that's provided here in this chat today is for information purposes only. If you have any questions around the COVID-19 pandemic, please visit our website at providence.org or visit cdc.org for updates and information. This event does not create a doctor-patient relationship, and any questions or medical items discussed are not considered guidance on what you should do. Always seek the advice of your physician or other qualified health professional with any questions you may have regarding a medical condition. So welcome. So it's great to see everybody here today. I hope you had a wonderful and restful Memorial Day weekend and were able to maybe get outside since there's not a lot of shops and things that you can do during Memorial Day. So joining me today is Dr. Nancy Eisenberg. Nancy is the medical director at the Center for Health Aging at the Swedish Neuroscience Institute. And Swedish is one of the many hospitals within the Providence system. We have 51 hospitals throughout the system, and Swedish is one of our hallmark hospitals up in the Seattle area. So thank you, Dr. Eisenberg, for your time today. It's great to have you here.
Thank you, Lori. I'm delighted to be here.
Well, it's just, you've got so many not names, but items after your name: MD, MPH, and AAP. Tell us a little bit about your background and your role and what you're starting up at Swedish.
So I'm a neurologist, and I have training in cognitive neurology and neuropsychiatry, and then I also have a background and interest in population health and a master's in public health. And I'm fortunate to be the medical director of our Center for Healthy Aging at Swedish Neurosciences Institute. And we offer comprehensive whole person and family-centered care for people with cognitive issues such as Alzheimer's disease and other dementias, ranging from prevention to evaluation to treatment. And we work with innovative and interdisciplinary approaches to partner with patients and families to come up with personalized, evidence-based treatment plans. And did you know, Lori, that 1 in 3 cases of dementia are preventable?
Wow, so, I did not know that.
Yeah, and also if you have dementia, you can live well with dementia also by focusing on targeting modifiable risk factors, such as hypertension, such as diabetes, such as depression or untreated sleep apnea. Wow. It's also really important to work with care partners and support their needs, and also to cultivate connection and lifelong learning.
Amazing. Well, tell us a little bit about, I know the work that you do has been ongoing, but in this particularly difficult time with COVID, talk a little bit more about the population that you're serving now that coronavirus is part of our daily life.
Yeah, I care for people with cognitive challenges such as dementia and their family members, and COVID has posed unprecedented challenges for healthcare. We've shifted to virtual healthcare, and so thankfully we have a really skilled team to help patients with dementia and their families to get on a virtual visit with telemedicine. And whereas that poses technological challenges, in most cases, with this support, people have been able to receive the care in their home, which is safe and where they need and have their care needs met.
So talk a little bit about what's needed for the telehealth. I know that our numbers have skyrocketed in terms of seeing patients in all different aspects of medicine, but how with this population does telehealth work?
So telehealth can work on your smartphone. Most people do have a smartphone or a tablet or a laptop. And through a link through MyChart, they can go onto a encrypted Zoom conference. And if that doesn't work, a phone call can be a good substitute. There are particular challenges that people with cognitive issues and their family members confront. However, often you can have a family member there or helping with the setup. And then our team is also walking alongside to guide the process and support the process.
And so have you noticed, during this time, more stress or anxiety with your patients? What's kind of the challenges?
So let's first acknowledge that we all are experiencing significant stress, and we experience it in similar ways and also in quite different ways. And the health and basic social needs for people in communities has really significantly increased, particularly for the poor, the marginalized, and the elderly. And the elderly are especially vulnerable for social isolation and for loneliness. And with this physical distancing, that is intensified even more. So family caregivers may not be able to receive the support that they need. They may not have the respite that they're used to, for example. Somebody with dementia may not understand the how and the why of the importance of physical distancing or wearing a mask, or why he can't see his grandson. People in nursing homes are even more isolated, and also their risk of COVID-19 is significantly increased. So that elevates the level of stress. So in these instances, we really have to stop and think about how to support individuals with dementia and their families. And so sort of turning to approaches that can help people to ground for the moment, to set up a routine. So as simple as 5 minutes in the morning of either mindfulness or prayer, and setting an intention to really target health behaviors such as a walk, such as healthy diet, such as focusing on sleep. In addition to physical distancing that reduces contagion risk, it's important also to media distance, because people with dementia can be upregulated with the media exposure.
Right.
Also, you know, really focusing on what you can control in the day and staying in the present moment is helpful.
Yeah.
You know, acknowledging the gamut of feelings, but not feeding the negative feelings, getting sucked up into media. And then also having a really
That's
broad
for all of us too.
perspective.
Yeah.
Sorry, yes, it's for all of us
That's
too,
for
for
all of
sure.
us too. Yeah. I'm
Yeah,
sorry.
right.
What
You
were you
know,
saying, Dr.
I
Rosemary?
was just saying, you know, to try to cultivate a broad perspective that we're all in this together. We're not alone. Life is hard. It presents challenges, and we will get through this together.
Right. And we don't know how much longer it's going to last either. I think that's the other thing. There's no kind of light at the end of the tunnel. You know,
This is a time of
yeah.
isolation, uncertainty, and loss.
Yes.
And it's very hard.
And so how is your, you know, I think we've seen a lot about the caregivers that we have, and the staff and nurses and
Right.
physical therapists, all the people that are really impacted by this, but how is it especially affecting your team?
Our team, I think, has been very nimble to meet this challenge where it is, and to develop the training and the skills, and to work with one another in a supportive way. You know, it is the moments sometimes are. You have to have humor and patience when you're working with these patients and families, because it's a new technology and it takes time. And at the same time, I think that our team-based model is bringing a lot of expertise and compassion to this, and really getting patients the care that they need in their homes in a safe manner. Yeah.
Yeah, and you were talking about families and respite care. So respite care would be when someone's a primary caregiver, but maybe their daughter can come in and take their father for a few hours or a day or an overnight. So now that we're not really doing that, sometimes, you know, people have to go to work, or they're out at the grocery. They're really worried about bringing COVID home. So how is social distancing?
I mean, you think about the sandwich generation, you know, so just imagine the way that COVID has affected people. So now you're working from home, you're homeschooling your child, and you're caring for your parent, your elderly parent who may also have dementia. And so it's really important in those moments to have compassion for those around you and for yourself. It's okay to need a break and to take a break. It's okay to feel what you feel, and it's okay to ask for help.
Right. Absolutely. And in what ways can people ask for help? What are some of
So,
the,
so there are so many ways that you can bring compassion into this moment. For example, just reaching out to friends and families who are isolated, you know, and physically isolated, picking up the phone or writing a letter, offering to do grocery shopping for somebody who's sheltering in place, participating in a food drive, and just really listening with your whole heart. Some people, they just may need to really vent or talk openly about the gamut of feelings that are rising up in this moment. Other people may actually really say, gosh, notice things like silver linings, the sense of spaciousness, or the time that they have with young ones that they may not have had. So it is the whole gamut of experiences. And so these are ways that you can help one another.
And we were talking earlier before we got on kind of about the conversation. And one of the things that you were referring to was this Dementia Action Collaborative. And we
Yes.
thought we had some slides to show you guys. We'll actually put them on afterwards on the chat box. But can you tell us about the Dementia Action Collaborative and what that entails? And
Yeah, the Washington State Dementia Action Collaborative is comprised of a number of stakeholders from a variety of areas in dementia care, ranging from people living with dementia to family caregivers, to people in long-term care, to people in clinical medicine, neuropsychology, research, geriatrics. And we come together to develop and improve dementia care throughout the state. And so there's a roadmap, there's a toolkit, there are actually virtual programs that are supporting caregivers and people with dementia through momentiaseattle.org or snowmentia or dementia-friendly communities. So there are programs that are continuing in this virtual space to really meet the needs. There's also Alzheimer's Association programs and other caregiver network programs that can be very helpful in this time.
well, one of the things I was thinking about too is we're spending so much time with family if we are together, right, in a household. And I'm wondering if there are people that have noticed that maybe their partner might have some cognitive delays that they might have not noticed in their normal daily life with going to work and all of that. And what would those people, what would be your advice to people like that that are noticing some things or even about themselves while they're home more and having a little bit more time to think and process and worrying about signs of dementia? What should they do?
That's a great question, Lori. And that's actually within the context of a 2020 Alzheimer's Association facts and figures, which identifies that fewer than 1 in 2 cases of dementia are actually diagnosed, and that frequently families will bring that concern and it may or may not be pursued. So I would say absolutely, if that's a concern that you have about a family member, to bring that to the attention of your primary care doctor for an evaluation. It's really important also because, as I said earlier, 1 in 3 cases of dementia are preventable, and there are always things that you can do in terms of personalized lifestyle approaches, connection, lifelong learning, perhaps reducing some medications that may have side effects that are causing the person to have memory loss. So there's a really, it's important to get that comprehensive evaluation to try to address those challenges. It's also important in terms of health span, thinking about quality of life, and then planning for the future.
Yeah. And I know
If you have those concerns about yourself and nobody else has those concerns, and you're also sleeping poorly and in the sandwich moment of that I referred to earlier, you certainly can share that with your primary care doctor. And I would also, for everybody, really point towards those healthy habits and really trying to be as consistent as you can with those kind of pillars of health and well-being.
that's great.
We can thankfully strengthen the neural circuitry of attention and memory with exercise, with mindfulness practices, by getting enough rest, by challenging the mind to learn. So there are things that we can do, by taking our medications to control these vascular and metabolic issues that I mentioned before.
And with diet too, right?
Absolutely, with diet.
Yeah.
So there's a beautiful study looking at over almost 5,000 people over 5 years. They cut their risk of dementia in half with a Mediterranean low salt diet.
Wow.
Wow. That's powerful, right?
Yeah, that is really powerful. And I eat
Yeah.
an incredible amount of salt. So that's worrisome.
Well, if you exercise a lot and you don't have high blood pressure, it's less of a concern, but
Okay.
many of us do have high blood pressure.
Yeah.
Hippocrates said, "Let thy food be thy medicine and thy medicine be thy food." And it's a very important what we eat. People are cooking at home more, they have more control of what they eat.
Absolutely.
It's an opportunity for sure.
Yeah. And with so many diseases, it's so important to catch them early, right? Prevention
Yes.
sometimes isn't possible, but once we have something and we know how to manage it, the chances of survival or living well beyond whatever the disease is so much easier for us. And what about with Alzheimer's or dementia? Recognize early. Can you talk a little bit about that?
Yes, you raise a very, very important point here as well with regard to Alzheimer's disease, because we know that for people, this neuropathological change occurs for decades prior to people manifest in clinical symptoms. And there are things which are neuroprotective, such as what we call cognitive reserve, your level of education and your lifelong learning engagement. Also, some people may be identified as having mild cognitive impairment, which in some cases is a precursor to Alzheimer's disease, but in other cases, people do not progress. So
Okay.
going and seeing your team and being identified as having a risk could potentially, and then talking about the things you can do to target that risk and change your course is very important. And we've mentioned those. That's cardiovascular exercise, sleep, diet, challenging the mind to learn new things, maintaining a positive outlook, treating depression if you have it, identifying and treating sleep apnea, doing a thorough comprehensive medication review, these kinds of things.
Great. So
Yeah.
things to think about.
So
And
you're
things
absolutely right that the earlier upstream that we can get, the more of a chance that we have to change the course. That said, I think it's important also in this context to acknowledge that people can live well with dementia. And there are all sorts of creative programs and services now around creative aging that really support that level of flourishing as well, that don't rely on memory per se, but which can stimulate the whole person.
Great. Yeah.
Yeah.
And for caregivers that maybe their loved one is not living at their house, they're in a nursing home. Do you have any advice for those folks? I was sharing with you that my dad has Alzheimer's, and my stepmom hasn't been able to go visit him for a long time here, and it's really it's heartbreaking. And so, any advice for those caregivers? I mean, we need them to take care of themselves. And
I think the importance of self-care in these moments, and also just being really honest with yourself and acknowledging that it is very challenging, and then focusing on the ways that you can stay connected, because that connection can really bolster you as well. So staying connected in the ways that you can, and staying well in the ways that you can, and then being true to yourself, that it's just that's a very, very difficult to be away from your beloved and to not have, some places they'll bring in the tablet and you can try to connect. Thankfully, we have these virtual ways to
great. And they've been
hyper-connect.
doing that. Yeah, absolutely.
Yeah.
And we know that's not possible.
But we do want to have a hug, of course. I mean, we're tactile beings, and it's a loss.
It's really a hard time for folks in so many ways, but this way in particular. And switching gears a little bit, on top of everything that you're doing at the Neurological Institute, you're also the instructor at the Compassion Institute. And so can you tell us a little bit about what's involved in teaching compassion, and what is the compassion cultivation training that you're involved in?
Yes. So compassion cultivation training is an 8-week program that was developed at Stanford University and is based on insights from psychology and neuroscience and contemplative practices. And it's been demonstrated to help strengthen the courage for compassionate action, to help you to manage your emotions, and also to promote resilience and prevent empathy fatigue and burnout. So it's a really wonderful technique that incorporates mindfulness practices and compassion and loving kindness practices. And people meet either virtually or face-to-face for a couple of hours over 8 weeks. And I've offered these practices in a number of contexts, whether it's with healthcare providers or hospice providers, or people who are caregivers for people with dementia, living with dementia.
So can you give a couple examples of how that gets started?
How a particular class might start? Or so I mean, you would start in the first class. You start with what's called a breath awareness practice to kind of ground in the body and to cultivate the neural circuitry of attention. And then we really explore what compassion is. And compassion, really simply defined, is it's an innate capacity that we have as humans, which we can also strengthen. And there's a lot of science about compassion, which I'll mention in a moment. But, over the course of the 8 weeks, we strengthen our capacity to notice the suffering, to ground in our body, and then to find skillful ways to respond to that suffering, whether it is in another or in ourselves. And I just want to come back to the question you asked about your stepmom, and that to say that we are as worthy of compassion as others. So if she's having a moment of suffering, to really kind of direct that compassion inward for herself, and to kind of be tender with herself and kind in that moment of suffering.
Yes. Yeah, I think it
So the other thing
especially
about
people like
compassion
that
that I want to,
yeah, go
sorry,
ahead.
I just was going to say the other thing I want to mention about compassion that's really incredible is that it can help us when we're feeling anxious and depressed to feel better. And
Mhm.
compassion is contagious. So compassion and collaboration are contagious in social networks. So if you show up with compassion, or if others are showing up with compassion, you can feel those ripple effects as they grow.
Yeah, yeah. It's been interesting just to see different neighborhoods that put in sort of a a tip for the day, or try to spread compassion in sort of tactile ways too. There was someone that's on our team that showed those wishes that you can make, and they were hanging on trees with a little compassionate note of like, we're all in this together. And he
Oh,
came running by about a week later, and there were 100 of them hanging from this tree. They had given out
wow.
kits and things. And
Oh,
so I know, I just love that. I thought, God,
I
I
love
feel
that.
mindful.
I love
Real
that. Yeah,
Yeah.
I found in my park somebody had left masks in the same way in little zipper bags.
Oh,
And
wow.
we feel hope because we're in this together and we're going to get through this together.
Right.
And those compassionate acts really support us in our interdependence.
And
Yeah.
just in promoting that, I mean, people have varying levels of compassion that they need, right, and require. And so I think just also recognizing who might need a little bit more care than others, or who might just be sitting silently because they don't want to call any attention to themselves. And
Yes,
how
and returning back to these elderly who are at risk, who are socially isolated and may feel loneliness more with the physical distancing, and really, ask just reaching out to those people
yeah,
in need,
are there
or
any
the neighbor who you may not see on the block, as
right.
as we talked about, right? Who may be invisible, but who need the care all the same.
Right. And have you seen
Yeah.
any ways of doing that? Is it just a knock on the door or a note, or what do you think is a great way to reach out to people? Call? What's
I
your
think all of those ways are great ways to reach out.
yeah.
I think somebody dropped by something in our front door around a food drive, for example, and um, some people have a religious affiliation that are mobilizing these efforts, and so there are all sorts of different ways to address these health and basic social needs in vulnerable populations. And in from the Center for Healthy Aging, we're especially focused on the elderly and care, people living with dementia and their caregivers.
And so at the Center for Healthy Aging, how many patients do you guys see?
That's a great question, and I'll answer that. I just started, and then we moved to
Okay.
virtual, and so
Oh,
I'm pretty new.
wow.
So we're
Yeah.
growing. I don't really have the.
And
Yeah.
how are people finding out about the Center for Healthy Aging? Is it
We
a
have
word?
a website through Swedish Neuroscience. So if they look at, you can put that Center for Health.
Oh,
There it
yeah.
is. Yeah.
There you go. Great.
Okay.
Yes. Yeah. And
Yeah.
what kind of research is going on in the area of Alzheimer's?
There's a lot of research right now in multimodal approaches to targeting risk. And I'm involved in a collaborative effort presently that's funded by the state
Okay.
to try to improve dementia care in primary care. And that's called Project Echo Dementia. And we're going to be looking at that from the lens of implementation science research.
Fantastic. Yeah, I know
Yeah,
that's just a breaking area for sure. And so many
right.
people, we're living so much longer. We're all worried about our brain health, and it's just so important that we all take better care of ourselves so we are able to have healthier brains as we age. So,
Yes, and
yeah,
knowing that there are things that we can do. I'll just say one more thing about that, which
yeah,
is there's a beautiful study looking at mindset, and people who have positive associations around aging
mm,
actually age better and have a reduced risk of dementia. So if they think it confers wisdom or they're going to be a grandparent, really cultivating these positive attitudes around aging, which, as you know, aren't always depicted in the media, right? So
right. Yes,
kind of
they're
countering those. I mean, in some cases they are, but really having that firm grounding as well, this kind of metacognitive awareness or mindset of positive aging, prolonging health span, and then knowing that there are things you can do in the day to day that significantly can improve your well-being and target that risk.
So get out those crossword puzzles, right?
If you like them, or try something else, maybe Zumba, or
Yeah,
put on that video, or get back at the piano. It has to be something that you enjoy. And
exactly.
the novelty is really important. So something that's new to you,
Yes.
ideally, is what strengthens the neural circuitry in the mind and
Yeah.
helps it to grow. We make brain cells also with exercise. So, getting your cardiovascular exercise on, and that can help also reduce stroke, which is a significant risk factor for dementia as well.
Yeah. Yeah. So doing new things. There's that country song, "When was the last time you did something for the first time?"
I
And when I
ah,
first heard that, I thought, wow, that's a really good question. I need to ask.
that is we gotta sing that song
Yeah.
next time we
Yeah.
see each other.
You don't want me to sing, but yeah. Well,
Yeah,
Nancy,
you don't want me to sing either, really.
it's been great visiting with you today and just such important work. Is there anything else that you'd like to share with people today that might be really needing to seek some resources or having some questions that they can turn to?
I think just underscoring that we're in this together and we'll get through this together, and that people can do what they can do, and knowing that that's going to help them to feel better. So, showing up with compassion actually helps you and those around you to stay well. And then knowing that that compassion is also directed inward. So, if you need a break or if you need help, call and ask and get the help that you need. And then, of course, the COVID safety precautions, which we're all taking, with physical distancing, and not with social, but retaining the social connectedness even in the face of that.
Yeah, yeah. I've been amazed actually how many people I recognize and recognize me instantly with my mask on if I'm out at the grocery or so
Hmm.
wearing those masks, and we're not out of this
Yes.
COVID situation yet. And so really being mindful of those we're meeting and those that are meeting us. So, out and about when we have to go out for food and things that we need in our pantry. So
Yes, right. The universal masking is very important, of course.
yeah.
Yeah. Yeah.
Well, Dr. Eisenberg, great to meet you today. And we want to thank you so much for your time and your expertise and for joining us. And to everyone for listening. And if you've got some questions afterwards, please send them in the chat and we will get back with you. And to learn more about our initiatives, programs, and services and ways to give, I am the Chief Philanthropy Officer at Providence, and Swedish has an amazing foundation that's head up by Jay Vogelsang. So please visit us at providence.org or at swedish.org. And to make sure and follow us on social media at Providence Health System, or on Facebook and Instagram under at Providence on Twitter. So thanks so much for your time today. I hope you have a great week, and keep your brain really healthy and get out there, exercise, read a new thing, and just enjoy life, give back. Thanks, everybody.
Thank you.
Bye-bye.
Bye bye.